Good afternoon, everybody. It's nice to see you all today, and thank you for joining our webinar. I'm Jonathan Toy. I'm the Group Manager for Trading Standards and Community Safety for Warwickshire County Council. And just to introduce my colleague, Emily.
Hi, I'm Emily van Deventer, Associate Director of Public Health with the County Council.
And welcome to all of you for our first weekly blog. We're doing this blog to provide event organisers for festivals and larger events some of the insights on some of our public health indicators that we're looking at in terms of the viability of events. And the idea of these webinars is each week we can give you an up-to-date information on where we are on each of those indicators. So if I can just quickly share with you the indicators that we have for you and for your events within the County of Warwickshire, and these have been agreed with all of our district and borough colleagues, and the idea of them is to enable you to look at where we are, the rates we're going at in terms of some key health determinants in relation to events and how we can work with you to make them COVID safe. And what Emily and I are going to do is we're going to go through each of those indicators and give you a position of where we are for this week, and then each week as we go along, so you'll have some insight as your event comes closer to its beginning date. So rather than go through each of these in detail, I'm going to hand over to Emily, and then she'll start talking about the first few of those indicators so you can see where our current position is.
Thanks, Jonathan. So I'm just sharing my screen, so hopefully people can see that now. And this chart shows the rate per 100,000 by district and borough, and then for Warwickshire as a whole in the dotted blue line. So if I just hover over there, you can see overall for Warwickshire, we're currently at 66 per 100,000, so a bit higher than where we would like to be in terms of those event indicators, where we've set a threshold of 50 per 100,000 for the county level indicator. Does vary by district and borough quite a bit there. So you can see North Warwickshire currently the highest at 151, and unfortunately that's seen a recent increase. Then looking at Rugby, 98 per 100,000, whereas then the other three, Nuneaton, Stratford and Warwick, are below that threshold of 75 per 100,000 for a district or borough level, but we would be looking at the combination of those two indicators. So as it stands at the moment, I think Jonathan would agree, we wouldn't be looking to have events based on the overall county figure and then the district or borough figures combined. But hopefully this is a blip, so you'll see the green bar there for Rugby. We had an increase, but it's starting to come down now, and most of that increase was associated with schools going back in the extra level of testing that they've been undertaking. So we're hoping these are bumps in the road and we will continue to see our overall rates decline. So that's one to keep an eye on. And then one of the other indicators, which is really important for us, is what's happening in the over 60s, so the age group that are more vulnerable to serious illness or sadly death. And the positive news is those rates are continuing to come down really nicely, and actually a very small number of cases per day in that age group now. So that is encouraging in at least. I'll stop sharing at that point. And pass over to you, Jonathan.
So the other element we're looking at is the issues in terms of our hospital transmission, our hospital rates. At the moment, in terms of our hospital numbers, we're not seeing the numbers that we were, say, about 4 to 6 weeks ago. So our pressures in terms of our hospitals, our hospital numbers in beds have gone down. The one thing that we are keeping a very careful eye on is the numbers that we're seeing, particularly for men in their 50s in terms of hospital admissions in an ICU. That is becoming quite a pattern for us as well. So we are seeing that very much a more vulnerable at-risk group, looking at the current hospital information we have at this moment in time. And that's something we're keeping a very careful eye on. So in summary, our levels in terms of all hospital admissions is down, and that's positive, but we are seeing a particularly vulnerable group of men in their 50s, and that's where our concerns are in terms of the ICU levels.
Yeah, absolutely. Thanks, Jonathan. So we spoke about the older age groups and obviously seeing the numbers come down there, but we are seeing, as you say, yeah, some quite serious illness in some younger groups, particularly where people are overweight or have hypertension as well. So keeping an eye on that. To go back to some good news, our vaccination uptake has been really good across the county. So over 80s, we're at about 96% coverage. 70 to 79-year-olds, 95%, 60 to 69, 92%. Don't yet have the coverage figure for the 50 to 59 age group, which is the current priority that are being delivered the vaccines as we speak. But we'll update you with that figure as and when it comes through. But the numbers are looking pretty good. So over 77,000 vaccinations delivered to people in that age group across Warwickshire.
That's really good news. The other element we're looking at is in terms of issues on new variants that may be impacting on our region or on our county. There's two that we've obviously been keeping a very close eye on. One is the Kent variant. We did see some challenges around that at the just the turn of the new year. And we're keeping a close eye on that. The other one obviously is the South African variant as well, which there has been a couple of cases near to our county, but not necessarily within our county at this moment in time. So that's something we're very much monitoring, and we're particularly concerned about those because obviously of the way that those variants spread. They spread in a slightly different way. They're much more transferable within smaller aerosol droplets, both indoors and outdoors, and we're doing a lot of work at the moment to make sure that things like ventilation, social distancing, the 2-meter distancing is very much maintained, as well as issues around hygiene and wearing a face covering. So that is a particular feature for us with the new variants. And we have a number of faith-based festivals coming up in the coming months as well, and that's something that we're very much working in towards, particularly around the social distancing elements. And a big thank you to those event organisers from our Muslim communities in particular who've worked so closely with us. So in summary, from where we are at this moment in time, if we were assessing an event for this particular week or the week ahead, we are seeing positive reductions in terms of over 60s. Our vaccination rates are good, but we have seen a bit of a rise in terms of recent prevalence rates within some parts of our districts and boroughs, and that has seen an increase in our rates across the county in the last week or so. And we would have a note of real caution right now about the viability of holding an event when those figures are beginning to rise. As Emily rightly says, we hope that's a blip, and we hope that over the coming weeks we can see those figures starting to change. And the value of these blogs is you will be able to see how those rates are changing and what those variations are going to be. So we hope that's helpful. And please get in contact with either of us if you'd like some further information. And if it's Emily, anything you want to add, Emily?
Just thank you for listening, and do keep tuned to these event updates. We do hope we'll be able to have a flurry of events in the summer, but obviously managed in a safe way if the wider epidemiological situation is supportive of it as well. So yeah, thank you.
Nicely said. Thank you everybody for listening. Okay, thank you.
Cheers.